In honor of Mr. Floyd, took the day off and spent time thinking about where we go from here as a community, coming together. Unique times, unique challenges, and certainly in the middle of a 101-year pandemic, it makes things even more challenging. So certainly we have some updates on some information related to that and restart other initiatives we're undertaking, and we'll take some questions. We lost a neighbor in the hospital yesterday. He's a Caucasian male in his 70s. And according to the New York State Department of Health website, we lost a neighbor in a nursing home. So I want to think about them and their families, pray for them. Certainly we need to think about and recognize loss of life in our community every day. That's what this pandemic should teach us. We had a violent last 24 hours in our community as well, so let's think about those folks as well, as certainly the mental health of the community is being tested. So we've lost, related to COVID, 151 people, 151 of our neighbors since this started in March. Related to testing, we've now tested 42,378 individuals, 41,319 tests have been returned, 1,035 returned since yesterday. There are now 2,243 positives since March 16th, 21 new cases, and 39,076 negative results. We've sent 1,322 tests since yesterday. We have 1,059 pending tests. Our now ratio of positive cases per test is now down to 5.4%. Reminder, when we were doing just symptomatic testing, that number was more in the lines of 8 to 8.4%. We then started to do strategic proactive testing, and now we're doing universal testing. Over the last 3 days from the New York State Department of Health system, the eClair system, we have averaged 1,769 tests coming back per day, and our 3-day infection rate in our county is 1.7%. That's the lowest it has been. Very good news. Universal testing at the Syracuse Community Health Center will continue. Next week, we have mobile testing. Today we are at the PSLA at Fowler High School doing testing. Next week on Monday, we will be at the Allen Arena on Jordan Street in Skinny Atlas. Folks from our far western towns can get there. On Tuesday, June 9th, we will be at Grant Middle School on 2400 Grant Boulevard over in the Eastwood, Court Woodlawn neighborhoods over there on our north side of the city of Syracuse. And then on Wednesday, June 10th, the Solvay Community Center on Woods Road over in the town of Geddes, the village of Solvay, my former county legislative district. So please take advantage of this. We're going into neighborhoods, trying to get people who have wanted to get testing, maybe no symptoms, feel fine, peace of mind. Please do this. It's there for you. Looking at our goal again, 775 a day for our region related to our restart metrics. We're going into week 2 of phase 2 tomorrow. We now are looking at 2,367 tests yesterday. We're averaging, that's 3 times more than what we needed. Daily average of tests from May 29 through June 4th, 1,633. Again, over double the tests necessary. And we know that there are some tests that are done at nursing homes that are always lagging. So we even know that there's more tests than this in the community. So our community testing infrastructure is strong, meeting those metrics. 64 individuals in the hospital. That's down from yesterday, 5 from yesterday. Out of that 64, we know about 34 are waiting discharge for a negative test of COVID. These are individuals that live in a nursing home. They got COVID. They were sick. They need to get into the hospital. There's an executive order that you need to test negative from a hospital to go back into a nursing home. We know that that time period to test negative is fluid. We don't know how long it takes an individual. Everybody responds differently. So we have these individuals that are essentially in hospitals even though they're not receiving treatment. We've put forward a plan to the state. We're waiting on that approval. We anticipate that shortly. When that happens, these individuals, these 34 individuals, will no longer be considered hospitalizations because they really aren't hospitalizations now. They're just essentially dorming there. So that is good from hospital numbers. We now have 12 individuals in critical condition. That's 1.3% of our active cases. Looking at who's in the hospital, 43 are Caucasian, 9 are African American, 4 of another race, 8 have declined to share their demographic information with us. To date, we've had 272 people that have been released from hospitals. Very good. Positive cases, again, up 21 on the day. That's a good number. 5 of these are household contacts of previously confirmed cases. Remember, when someone in your household tests positive with COVID, you're going to be in a quarantine. You're not allowed to leave the house at that point. You're then in a situation where maybe a loved one, a roommate is COVID. You then become COVID positive later on. You develop symptoms. We've kind of baked this into the process. We knew this. This doesn't strain our infrastructure, but also it's not a true threat to the community at large because these folks have already been in a quarantine. 13 of our cases related to facility spread, basically nursing homes, and that leaves 3 cases for a community spread. That's our best number, I believe, since week 2 of when we started seeing cases. So 3 community spread cases, very good number. The community has responded very well. At this point, if this data continues, our caseload essentially in the county is facility spread driven. Looking at active cases, 917, 1,180 people have recovered. Asymptomatic, not related to nursing homes. So this is folks who are going in curious about if they have COVID, no symptoms. 20% over the last week of the new cases, non-nursing home or non-facility spread cases, 20% of them are asymptomatic. We'll learn more about that at some point. Looking at the cases, 1,336 are female, 907 are male, 115 are under 19, 370 are in their 20s, 295 in their 30s, 279 in their 40s, 350 in their 50s, 282 in their 60s, 221 in their 70s, 204 in their 80s, and 127 individuals have been in their 90s. Breakdown by municipality. First number are total cases by municipality. Second number are recoveries. 1,273 with 609 recoveries. 170, that's the city of Syracuse. Town of Clay, 171 with 114 recoveries. Town of Onondaga, 137 with 48 recoveries. Town of Geddes, 117 with 33 recoveries. Town of Salina, 100 with 60 recoveries. Town of DeWitt, 82 with 58 recoveries. Town of Manlius, 79 with 58 recoveries. Town of Cicero, 70 with 44 recoveries. Town of Camilla, 68 with 45 recoveries. Town of Lysander, 40 with 36 recoveries. Town of Van Buren, 30 with 12 recoveries. Town of Pompey, 26 with 23 recoveries. Town of Skaneateles, 15 with 15 recoveries. Lafayette, 8 and 4 recoveries. Marcellus, 8 and 6 recoveries. Elbridge, 5 and 3 recoveries. Atisco, 5 with 5 recoveries. Tully, 4 with 2 recoveries. Spafford, 3 with 2 recoveries. And Fabius, 2 with 2 recoveries. 1 week into phase 2, essentially, right now. Starting to see some of the information. It doesn't look like we have any real uptick at this point. Certainly, there have been mass gatherings. We know that these are in conflict with COVID-19 virus. We'll see maybe over the next few days what that means. Certainly, folks who are going to be involved with the mass gathering certainly we ask that you wear a mask at minimum. Related to this week, a big week, we got a lot of us have been lobbying now successfully to get outdoor seating at restaurants to help help get people back to work, help give these business owners a chance to expand their operations, but also to give us a chance to just get outside and sit down and enjoy each other's company in a way that we're used to. So a big win. Certainly we want to encourage people to get out, use the outdoor seating, bring your mask. Certainly when you're at the table, you don't need to be wearing one. But it's important that that was a big win for everybody to get that out of phase. Looking towards the weekend, I know the mayor gave a briefing with Chief Buckner earlier. Certainly there's a county-wide preparation for what seem to be very large protests. We're prepared, and certainly we have all of our teams working very well together in preparation. Very proud of many of the protesters have communicated very well with the law enforcement partners, and things have happened all week successfully. So let's continue that going into tomorrow. Successful, peaceful protests. That's what we need. I had an executive order that I put out a short time ago related to restaurants that allows businesses to expand their outdoor seating in municipalities. Why is that important? Right now, to expand outdoor seating, depending on the municipality, you may need zoning board approval, planning board approval. There's a lot of red tape around that. We want to get these businesses going, and so the executive order allows these businesses to get through that red tape. Certainly, if you're going to be in the public right-of-way, though, you need to have liability insurance because the municipality will not be responsible for that. So saying that, happy to take some questions.
I was in Mattydale today where about 50 homes are planning to have a neighborhood-wide yard sale, which, according to the state, is not yet part of the allowed guidance. What's your response to this neighborhood planning to do this, despite their claim of safety regulations in place?
I've heard about it, Andrew. I haven't really dove into the legal side of this. My understanding is those who are having these yard sales are suggesting that these are not garage sales, that they are yard sales. I don't know the difference, but that they are not going to have more than 10 people, and they're going to physically distance and wear masks. So I don't know if that falls, what EO falls under. I think at this point, we ask people to be practical, and we know when you have more people together, there's more opportunity for the virus to spread. Right now, we know that there's mass gatherings in the community. So there's the practical side of this is we need people to just do the right thing and be safe. If you're asking the question, are we going to be enforcing yard sales in Mattydale? The answer is no. We have over 1,000 people that are going to be downtown. So that's the answer to that.
I know that there are plans in place for this weekend. Any plans about putting a curfew back on Saturday at all?
That's an option. I don't. Right now, I think with the way that the protest is being organized right now, I think last time I know it was 1 to 3 or around there. Maybe it moved. But certainly that gives the mayor, myself, an option if conditions merited that technique and tool for law enforcement to keep the community safe, to prevent looting, to prevent damage to property. Previously, obviously, we had storefronts, over 18 of them damaged downtown, but we had storefronts damaged in the suburbs as well. And so that's not acceptable behavior, and we will give the tools necessary to law enforcement to prevent that. I think if you lead with that tool, when that it creates a level of anxiety. It creates some of these folks who don't have good intentions. It gives them something to point to further protest and try to stir up emotions. So we're ready if we need to on Saturday to act, and we'll be following the situation closely.
Have you been briefed or involved with any additional planning, any changes to policing, police force tomorrow?
I've been briefed by SPD, the sheriffs as well, and certainly our teams are all working together, and I think SPD has done a really solid job with the circumstances that they've been put under, and all of our partners. I think the protesters, the organizers of most of these protests, have done a very nice job as well, keeping these focused in on an important message. So we need that success to continue. I'll be briefed probably at the end of this day, and I'll be briefed in the morning as well.
So earlier today, Chief Buckner told us about a couple of spots where we expect protests tomorrow, downtown in front of City Hall and at the Public Safety Building. Do you have any advice for people where you expect some gatherings to be in the towns or villages?
We have not heard yet of specific large gatherings outside of the downtown area. Through experience, we know that times there'll be a gathering and then folks will want to move into other neighborhoods. We had gatherings and protests going into, I believe, the west side the other day, the north side, and those work well when they communicate with law enforcement. And previous Saturday, they actually went all the way into the town of Geddes. So our teams overall are synchronized for a county-wide purpose to keep the community safe and keep the people safe, property safe. And certainly if things were to spread outside of downtown into city neighborhoods or into towns or villages, certainly all teams are working on planning to make sure that that can be done safely.
I know that the governor is encouraging protesters to get tested. Is there any initiative on your part to have protesters downtown get tested for coronavirus? I mean, I know that there's universal testing now, but is there anything that you guys are doing?
Well, you gave me an idea, but maybe we should bring the mobile testing lab to a protest. But I think right now, what we can do is what we're doing. Is we have this mobile testing facility going into neighborhoods. We have the Syracuse Community Health Center open. If you've been at a protest, you've been around people, you've been very close, you don't know these folks that well maybe, it's just smart. Just do it for yourself. If you don't do it for yourself, do it for somebody who's over 65 years of age or might have a pre-existing condition that you love, and go get tested. That would just be our advice.
Have you seen an increase in demand from people who had been protesting?
Too hard to tell, Andrew. I couldn't even tell you if we've had one. I know in the screening process, it's something Dr. Gupta is aware of in the tracing. But right now, too hard to tell. We would probably start seeing folks if they got symptoms right around now, maybe yesterday. So we'll know. We're in a really good spot in the community with this virus. When you look at a community, 20 cases when you're doing 1.7% infection rate, 20 cases when you're doing all this testing, these are just tremendous numbers. So I would hate to see us go backwards from the pandemic side of things. I don't get the sense that we are, but it's a concern.
Do you have an update on the number of businesses that have affirmed they're safe to reopen?
Yeah, they gave us 79 new ones since yesterday, Terry, on the call. Maybe what we can do when we get that number, that was supposed to email us later today, maybe we'll email the total number. But I know Central New York wise, we're probably over 2,500 out of all the counties. But I think 79 was the number of new ones from yesterday in Onondaga County, I believe.
On your regional call, has there been any specific mentions of phase 3?
Talking about it, we reviewed the dashboard metrics to compare them with what we talk about every day today, and they all look great. And actually, they'll get better. Our hospitalization numbers, once you get these folks out of that number, stellar. So the from the health perspective, and I think you saw in the governor's briefing where the state has made tremendous progress. And so the fight with this virus is, you know, we're in a good spot right now. We still need to be diligent. We still need to do smart things. But as we move towards phase 3, there's nothing holding us back right now.
That was the case with phase 2, and we saw
Sure.
the drama that unfolded. Any clarity on how it will be communicated a week from now?
Yeah, we talked a little bit about that, you know, the 14, maybe 15-day process, maybe a little bit earlier if some of these advisors of the governor get their work done a little bit earlier. But when you look at it, I know they look at different things than we do, I'm sure, some of these epidemiologists. But when we look at the numbers every day, what are you going to say? 3 community spread cases is going in the wrong direction. So, you know, our average this week's going to be, you know, probably under 10. Might be 9, might be 8, might be 7.5, might be 9.9. But this is all considering that we just brought thousands of people back into the community every day interacting with each other. So the healthcare numbers are solid. There's still a lot of great work being done by many people in the public health arena and our hospitals, and they're still busy. But you know, you know, it seems we've turned a corner here.
Earlier this week, I had asked about following up with the asymptomatic cases, and I just wondered if you had an update.
I don't have an update on that, Terry. How many? Your point was how many asymptomatic folks that we tested. How many of them, or is there a trend on them becoming symptomatic? And so we did put that request into the health department.
Have you been out with the protesters this week?
I've
If so,
met with
what's your
different leaders, and I've had some conversations. You know, I would love to get the leaders together and understand more. Part of what I think is positive that there's a framework to build on is in county government, and you've heard me talk about this, many of you have asked this before, and I've reminded people that I don't have my own police department. So related to some of the immediate changes that many of the protesters nationally are talking about, they're talking about changes to the way that police departments report things and procedures on how they interact. My office doesn't have a large role in that. But when we talk about systems and you talk about investments, I'm very proud of the work that we have done before this pandemic, this 101-year pandemic started. We talked about our PI platform, you know, poverty and infrastructure and economic development. We talked about specific strategies in public health, and we talked about early childhood investments and workforce development investments, education investments, transportation, making sure that folks can get to work, because if they can't, they're not going to go to work. So these are all things that I could sit and show how our community has made investments that help change the systems and that will help deliver better outcomes specifically for folks in many of our minority communities. And so sometimes it's tough to communicate that, especially with a generation that's just getting active now, being galvanized now. So I'd like to have dialogue with many of these young leaders to show them what we're doing, to get their feedback. I think we need these young leaders to be at the table and you know, to help be constructive so that we continue to move forward with investing in underinvested communities.
I know nursing homes are a very vulnerable place for this virus, but I also know people are really eager to get back in to visit people. any information from your state calls about when even assisted living facilities might have a loosened restriction on visitors?
I feel that, again, Andrew, this is really tough. I know families are dying to see their loved ones, and their loved ones are in a fragile state, many of them, with their own mental health in these facilities. So seeing a loved one is so critical. So we're encouraging balance, but even the CDC, the federal government, saying is this is the last thing that can loosen up. Look what's happened. Our numbers are driven by the fact that these facilities have been attacked by this virus, and it's just, you would hate to make a decision too soon on that. There's many parts of this process I think are way too conservative, and I think are moving way too slow, and I think even some of them are, at this point, it's hard to make even a rational argument to defend, but this is not one of them. This is an area that you cannot make a mistake with our most vulnerable. We know today that these are the folks 65 and over with medical existing conditions. This virus preys on them and attacks them. These folks go into a hospital, they go into your ICU, and we don't get all our neighbors back out of the ICU room. So we need to be very conservative.
Any update on churches?
I have pleaded and begged to get these buildings open. My personal view is churches are essential, and I'm going to need to go to church on Sunday.
Last night, I did a report about, as you consider layoffs in the county, Monroe County is able to pay hazard pay to some employees the way that the CARES Act was based on population of a municipality. Do you know where the money that was allocated for Onondaga County that went to New York State stands in terms of its status? And what specific conversations have you had with the federal government partners you work with to make sure that doesn't happen again?
So we've had the first part of your question, to your point, is in the CARES Act, the state did receive money for local governments related to COVID. I don't know where that money is. I could use some of that money. The second part, have we talked to our federal leaders? I've spoken directly with Senator Schumer, directly with Congressman Katko on this many times. The policy of $500,000 direct funding is something we want changed. That's going to be, that policy doesn't just impact COVID funding, it impacts everything. Selfishly, we would like it changed to $450,000 because us and maybe two other communities in the country are the ones in between $450,000 and $500,000. But that's a longer fight, but certainly, as you highlighted, it is one that is drastic when you look at the funding Monroe got compared to Onondaga County. What I will say is Senator Schumer and John Katko, Congressman Katko, have been allies. They have put forward a bill for COVID 4.0 that would help the county get a substantial amount of help. Is it enough? No. But we recognize that all of our problems won't be solved by one piece of legislation. So both Senator Schumer and Congressman Katko have worked very well with us on that bill. My hope is that's the bill that makes its way through the Senate. And I think Senator Gillibrand has sponsored that as well. There's another bill in the Senate by Senator Kennedy of Louisiana and Senator Menendez of New Jersey, a bipartisan bill that has gained some steam. I think other representatives in New York have signed on to that one. We don't know enough about that bill, how that works out for us. Maybe because of the impact we've had, it's like a third population-based, a third revenue loss, and a third infection rate. So maybe that bill actually works out better for us. We just don't know. So those are two bills that have momentum. We need something. And the timing of it is so critical because you can't make assumptions that there's going to be a bailout package for lost revenue. And so each 2-week period that goes by is another 2 weeks that we have to essentially cut in our budget. And that's what we've been doing this whole process. So if this happens in June, some of the decisions that we would have to make, maybe we don't have to make until later on in the year, which helps with the recovery and helps with pain overall. So it's pretty desperate. There's a lot of things pretty desperate right now. There's things that we need done in the community. Terry asked about churches. Our faith-based leaders have not been sitting on the sidelines in the respect that they still are doing their mission. We need them fully engaged in the game now with everything going on in the community. No reason not to. Enough on that. No reason. We need to get it done. Package in Washington, D.C. No reason not to. You told every community in the country that you got to be shut down till May 1st. There should be no debate about help with states and local governments through that period where you said we have to be shut down. There's no debate on that. Enough. We need to move forward. If you want to debate the 2 weeks after where it took some states to restart their economy, have that debate. But overall, I think there's certain things we got to move forward with. You can't make so much progress the way we are and not keep moving forward with reopening life on the health care side and on the DC side. Like what are we waiting on? You got good unemployment numbers today. 2.5 million people went back to work. Okay, if you want those things to continue, if you don't want governments to have to lay off 2.5 million people collectively next month, then you got to help us. And this isn't. We didn't have a balanced budget. We had a balanced budget. We managed a $7.7 million surplus last year. We would have had another big one this year. But the 101-year pandemic that we all expected happened this year. So we're getting frustrated with some of the inaction.
You mentioned that as county executive, you don't have a police force, but you are in charge of departments such as probation and
Yep.
the 911 center. And are you starting to think about those things? For example, often when people call 911, they don't necessarily need a police officer, but they do need some sort of social help, such as a social worker or perhaps assistance with, dealing with things. So I just wonder if that might be a way that as the county can start to look at the system and rethink some things.
Yeah, I think our probation department now is a bigger piece of the criminal justice reforms that have happened. And I think that's part of this too, Terry, is a lot of, if you look at what's happened in the community, there's been a lot that's happened, but in another community, the country got to witness what happened to Mr. Floyd. And so there's many communities that have not taken the proactive steps that we have in New York and central New York. But we're always open to best practices for community relations and to have better efficiencies in the services we're mandated to provide. And so our probation department is fantastic when it comes to that. We know these folks very well. We help these folks. Many of our probation departments end up being mentors to people that they used to work with. So from a community relations standpoint, we're always open to best practices and suggestions from the community at large. Other questions? Okay, so going into next week, we are going to do these briefings on Monday, Wednesday, and Friday. Right now, we're moving forward to the point we've been in restart. We were in response to this pandemic. Now we're in restart. Part of this restart is now economic recovery. Believe it or not, these briefings take up a lot of our time getting prepared to answer all these questions. And so I need to refocus some of my time and our team's time on economic recovery. So we're going to slow the briefings down. But certainly, if something is to pop up over the weekend, we'll certainly be in touch with everybody. Okay, so we're proud of the community, what you've all accomplished collectively. Think about this COVID-19 crisis. This is once in a 100 years pandemic, and we're all living through it. We're all making so many gains in it. I'm so proud of all of you because you have done it, not the elected officials. We've helped, but you've done it. You've done the hard work. And certainly for the community at large, I want to thank the folks who have gotten out and have made their voices heard in a peaceful way. and want to encourage that. And certainly to our law enforcement partners, let's continue to have a good weekend, and let's have everybody be safe. And I will hopefully see everybody back here on Monday. Thank you.